Hello, everyone, and thank you for joining today's webinar. We at Families USA hope that you and your families and loved ones are hanging in there and remaining safe during this time. My name is Jane Sheehan, and I am the Senior Federal Relations Manager at Families USA. As our nation confronts a public health and economic threat greater than any we've seen in a century, every family is struggling to understand and manage the devastating and far-reaching effects of COVID-19. During this crisis, families need unfettered access to healthcare services. With unemployment higher than it's been in decades and widespread economic uncertainty, we also must ensure the financial security of America's families. We're going to spend the next 30 minutes discussing a critical issue in our healthcare system, surprise out-of-network bills. We'll also discuss why we're urging Congress to protect families from further financial certainty as they seek healthcare services by banning surprise out-of-network bills in the next pandemic relief response. So just a few items of housekeeping before we get started. This webinar is being recorded and will be shared out afterwards. To ask questions, you can type them into the chat box on the side of your screen, and we will get to as many as we can at the end of the presentation. So today, again, we will be reviewing the issue of surprise billing, discuss why it's even more critical at this time, and then why we're urging Congress to act. We'll also discuss a digital week of action that we're launching this week. That we're leading with some of our partners in the No Surprises campaign, and also discuss how you can get involved. And of course, we'll leave time for questions. So for a bit of review, for those of us who might not have been able to join for our last webinar, surprise billing, also called surprise out-of-network balance billing, is a common problem when, through no fault of their own, families receive medical treatment from an out-of-network provider. This occurs most often when families receive emergency care, or when they do their very best to go to an in-network provider, but later discover that physician services or ancillary services like anesthesiology, radiology, lab, or ambulance fall outside of their provider network. Surprise billing is incredibly common. Roughly between 1 in 5 and 1 in 6 emergency department visits that families make result in a surprise medical bill. And these bills can result in hundreds, thousands, and even tens of thousands of unanticipated out-of-pocket costs. Many families are not prepared for the financial hardship of handling these additional costs. For example, according to a 2018 survey, 4 out of 10 Americans reported that they would have trouble covering a $400 unexpected expense. And you can just see a couple examples of how high these bills can get right here. Now more than ever, families are vulnerable to unexpected healthcare costs due to both the rising unemployment rates and the spread of the pandemic. Between March 15th and April 4th, more than 1 in 10 workers filed for unemployment, and the number of unemployment claims is expected to increase over the coming weeks and months. During this time of increased financial insecurity, individuals shouldn't have to fear or manage the financial impact of receiving a surprise bill that they incur for putting the health of themselves or their family members first. So Congress must act now. There are already reports of families receiving very large medical bills in relation to COVID-19 testing and care, including parents receiving thousands of dollars in bills for coronavirus-related screening and care for themselves and their children. Now, patients will be protected from the cost of COVID-19 testing thanks to legislation recently signed into law, but families might still be charged for services related to testing, such as ambulance fees, out-of-network lab fees, or out-of-network facility fees. And although the administration very recently announced that the emergency pandemic funding going to hospitals and providers has to be accepted with the caveat that they cannot balance bill those seeking care for COVID-19, despite these safeguards, comprehensive protections are still needed. Now, this is because many experts believe that the possibility of surprise billing during the pandemic is even more likely, as many families are pushed to out-of-network hospitals for both health emergencies and routine care due to hospitals, many of them being just overrun with dealing with COVID-19. So, these are costs that many families are going to be unable to bear during this downturn. Between 2013 and 2016, medical bankruptcy was responsible for more than half of all bankruptcy filings. During this uncertain economic climate, Patients need immediate protections to shield themselves from further financial constraints and possible medical bankruptcy due to surprise bills. And this slide just kind of shows some of the unexpected costs that many families worry about based on the polling we did in the fall, and medical bills are at the top of that list. So what is Congress considering? There is strong bipartisan support and agreement on a solution to end surprise medical bills, both in Congress and from the White House. And we believe that a legislative solution is ready. Before the COVID-19 pandemic hit, Congress had spent more than a year working to understand the issue and develop a legislative solution to surprise bills. Both the House and Senate committees of jurisdiction have developed and advanced bipartisan legislation. And additionally, there's consensus among hospitals, provider groups, consumer groups, employers, and many others that have all agreed on the contours of legislation to end bills, and most importantly, that patients need to be protected. This is why we are continuing to call on Congress to act. It's important that they act now to protect consumers from surprise medical bills. These bills related to COVID-19 and that incur at this time could be arriving in the coming weeks and months. This is far more than an economic issue. The fear of surprise medical bills could influence people with coronavirus symptoms or people in their families to delay or avoid seeking care, which could worsen the outbreak in the weeks and months to come. So this just shows, as I said before, the committees that have already worked on this legislation and on a bipartisan basis, and some of the key policies and principles that we are writing this legislation based on. So Families USA Action and a coalition of our partners from groups representing patients, families, and workers launched the No Surprises campaign back in the fall. Some of the partners are listed on this slide, and all of our groups here listed here agree on these three principles: banning surprise billing and fully protecting consumers, containing total costs for consumers and not inflating overall healthcare costs, and ensuring that these protections are comprehensive and nationwide. So this week, we and many of our partners listed here are going to be taking action to amplify this issue in a digital week of action and encourage Congress to enact these protections. I'm going to turn it over to my colleague Raven in a minute to go through some of the ways that you can get involved in this. So we really are urging action this week to kind of help bring all this together and target pressure with the many things that Congress is dealing with and trying to advance. So we will go through some of those in detail and we'll answer questions at the end, and now I will turn it over to Raven.
Thanks, Jane. Hi, everyone. My name is Raven Gomez, and I'm the Partnerships Coordinator here at Families USA. As Jane mentioned, I'll be talking about our Digital Week of Action and the tools that you can use to amplify your voices and your advocacy around surprise medical billing. So Families USA Action and our partners in the No Surprises campaign invite you to participate in our Digital Week of Action happening this week from April 20th through the 24th. On the next few slides, I'll be discussing different tools that you can use to encourage Congress to take action on surprise medical bills during this week. And I just really want to highlight how important your voices are. They hold so much weight with elected officials, and they have the most influential power when it comes to advocating for these important issues. So your actions truly make such a huge difference, and by rallying together, especially this week, we can make sure that all of our voices are being heard by our elected officials. So direct outreach is one of the most effective forms of advocacy that you can do, and calling your member of Congress makes a really bold statement on how urgent it is to address surprise medical bills. So you can use our calling tool at nosurprisescampaign.org/action to take action and call your members this week. We'll be setting you up with a script, talking points, and we'll even patch you through to your member's office. So all you really need to do is have one handy, and we will handle all of the rest. And I'll be sure to, once my slides are finished, post the link to the action toolkit that you can use to see the tools for yourself. So if calling isn't your forte and email is more of your style, we also have a tool with a template and customizable language that will send your message directly to your representative. It is so important to send a clear message that there is no excuse to not pass surprise billing legislation. We really want to make sure that this issue is top of mind for our elected officials, and email is a great way to put pressure on them to take action. So for folks who prefer to advocate on social media, we also would encourage you to tweet at your members of Congress to act on surprise medical bills. You can use our Take It to Twitter tool, which provides direct tweeting assistance in template language, or you can even draft your own tweets using the hashtags #EndSurpriseBills, Pass a Bill or Pay Mind, and No Surprises campaign to amplify your voice and kind of join the online social media movement around the ending surprise billing legislation. Finally, if you or someone you know has a story related to surprise medical bills, please be sure to share it at nosurprisescampaign.org/shareyourstory. By sharing your story, you speak up for the people who may be facing issues just like yours. So it's really important to remember that you are the key to the success of this movement, and your action is absolutely critical. I mean, Congress won't act if you don't take action. So your advocacy around this issue really does make a difference and is so important for the lives of so many people in this country. So I want to make sure that we have time for questions. So I'm going to turn things back to Jane. So thank all of you, and Jane, take it away.
Great, thank you, Raven. And again, thank you all for taking the time to join today. I know that a lot of people are dealing with, obviously, some people are teleworking, a lot of people are taking care of their families, and we really appreciate your time, which is why we wanted to keep things on the shorter side today, just to be respectful of that. But the good news is we do have plenty of time for Q&A, so a reminder to type any questions into the chat box, and we will get to as many as we can. So Raven just did a great job of going over some of the ways you can get involved this week. We'll make sure everyone has access to those tools after this call. I also wanted to flag that Families USA Action and No Surprises will be coming out with a new short analysis. Probably later today we'll have it published and make sure it gets sent around to everyone who joined this webinar. And that analysis will be kind of directly making that connection to what families are going through right now, dealing with the health and financial impacts of COVID-19, and how surprise medical bill protections are even more critical at this time. So, I think, and just to kind of put a finer point on that, this connection is there because we don't want families to be scared to get care because of financial concerns, period. Folks that are insured, their insurance should work so that they can get preventative care, testing, and treatment, whether it's for COVID-19 or the seasonal flu, or a broken arm without having to worry about financial ruin. So this is a huge test of our healthcare system right now, with millions of people potentially facing unexpected medical bills due to coronavirus or related to coronavirus. And this issue has always been important to us at Families USA, but with this global pandemic on a scale that's never been faced by our health system, we're calling on Congress to act to ensure that consumers are protected. This is the moment. So with that, we are going to answer some questions here. Let's take a look at the chat box. So this is a really good question. What should we do if our congressional members, are already on board with this? They're already champions for ending surprise medical bills. Maybe how do we convince the people that aren't in our state how to support legislation? And that's a really good question because, as I said, Congress has been working on this issue now for more than a year. There have been 3 committees in the House and 1 committee in the Senate that has advanced legislation to address this on a bipartisan basis. So, this isn't a partisan issue at all. It affects people from all over the country. So I think if you get the signal that your member of Congress in the House and your senators are already behind legislation like this, it always helps to give them backup, to let them know that you're supportive, because they are dealing with many priorities right now and trying to figure out what to include in this next relief package. So I think hearing from you that you are still behind them, you appreciate their support of ending surprise medical bills, and you think that the time to act is now. I think even if a member has been supportive in the past, it's important to push that forward. And then I think, talking with your networks. If you have friends or family in other states or other congressional districts where their member has been quiet on this issue, having them speak up and having them reach out is always really helpful too. Let's see, what else do we have? So we also have a question about, hold on. We also have a question here about the role of private equity in this fight. So, private equity firms have played a larger and larger role in healthcare over the past few years, both buying up staffing firms and physician practices. And many of these firms have made surprise billing part of their business model by keeping providers out of network on purpose and then foisting these high bills on patients and really exploiting them. Some of these groups have also been actively pushing back against legislation that would protect patients. One of the big ones has been spending millions and millions of dollars on ads over the past few months, starting back in the fall, called Doctor-Patient Unity, which is kind of purporting to represent patients, but really just working to protect their bottom line. What's even worse is we're hearing now, at a time when doctors and providers on the front lines, need to be supported to care for their patients, these same private equity firms are in fact cutting hours for these providers and pay. So really just, again, working to protect their profits. So we're watching that very carefully and encourage folks to push back. Let's see. Some more great questions here. So let's see. Kind of speaking to the actual legislative solutions that are being considered. We didn't get into too much detail on this webinar today about the details of the solutions that Congress is considering, but as I said, there is really broad agreement around protecting patients and having really robust protections for patients. All of the committees in Congress that have marked up legislation so far have shared those really strong protections. Where there has been some disagreement is how, when the patient is protected and doesn't receive the surprise bill, how is the payment worked out between the insurer and the provider? And there have been a couple schools of thought on this and several compromise solutions that have been advanced on the Hill. So, one idea is for there to be just kind of a benchmark payment. So based on the average rates in that area, the insurer would pay a provider kind of this average median benchmark rate. Others on the Hill and around the country have called for a solution with an independent dispute resolution process. So the provider and the insurer can go to this independent dispute resolution arbitration process and work with an independent arbiter to come up with a fair payment rate from there. Families USA Action, we believe that the benchmark approach is the most straightforward way of solving this issue, and that holds healthcare costs down and ensures payment for the provider. There have been, again, some compromises on the Hill that kind of combine the benchmark and arbitration process. The Energy and Commerce Committee and the Senate Health Committee came to an agreement in December that kind of combines these two ways of doing things into a bipartisan, bicameral process. I think that's the solution that we support the most. Again, I think committees have been working behind the scenes to come to an agreement here, and I think it would be to be determined what this final agreement would be, but we hope it would look something like that. So a lot of really good questions here. Okay, so this is actually kind of related to some breaking news that happened over the weekend. There was a few reports that kind of expanded on the fact that the recent coronavirus legislation, that the CARES Act, recently enacted by Congress and signed by the President, had some surprise billing related prohibitions in it. So how we're reading this, basically the CARES Act, which was passed by the Hill a few weeks ago and signed, the administration made an announcement last week and then put out some further kind of guidance on that announcement that the relief funds the emergency relief funds for the pandemic that are going to hospitals and providers and the healthcare industry during this time. Terms of these providers accepting those relief funds, in order to accept them, they have to basically not balance bill COVID patients. And we think this is very positive. As we've said, families seeking treatment, testing, and care for coronavirus shouldn't have to worry about surprise bills, and we think this is a really important step that will help protect them. We do fear that, of course, there'll be some loopholes there and families can still get hit, but we are very supportive of this. I think, we just want to make sure that with these protections, Congress still feels the impetus to act for comprehensive protections. As I kind of said earlier in the webinar, folks who are receiving care at this time for treatment, both related to coronavirus, but also, if you break your arm and go to the ER and you have to go out of network because your local ER is just really, overwhelmed dealing with COVID-19 patients, we don't want you to get surprise billed then either. So that's why we really think that these comprehensive protections are needed. Okay. So we have another actually really good question here about, during a normal time when Congress is, either in DC or back in their districts for congressional recess, advocates, as I'm sure many of you know, for years and years have kind of a playbook of how you influence your members of Congress on the ground. You can have, in-person rallies. You can have a bunch of phone calls going to their offices. You can write letters, etc. And we think a lot of this can still be done, but I think we all have to be a bit more creative these days with this kind of, virtual, indirect way we're all interacting with each other. So I think there have been some questions on the effectiveness of, calling your member of Congress, because what if they're not in their office in DC or their district office is open, etc. So, in terms of calling, we know that, staff still are manning the phones in most offices, whether, they could be doing it remotely, but I think if you call your member of Congress's phone number, someone should be picking up on the other end. During this crisis, it's more important than ever for members to stay connected with their constituents. And, so we still encourage you to try to call if you can. That being said, we think email and social media are also effective in putting pressure on members, email especially. Members of Congress at this time really want to know what's important to their constituents as they're considering the next round of pandemic response. So, I would encourage you to go back and look at some of the tools that Raven talked about and that we have on our No Surprises website. And yeah, keep those calls coming. All right, let's see, maybe I have time for one more question and then we'll wrap. So this is a good question, kind of clarifying when and where balance billing can take place. So is it based on where you get care, or where you live or what insurance you have? And it's kind of all three. So many states, over the past several years, more and more states have been enacting surprise billing protections on the state level. Maryland, Colorado, New York, California. Some of these states have protections in place, and many more. The issue is that, unfortunately, this can't apply to all insurance plans. For example, employer-sponsored insurance, ERISA, is regulated at the federal level. So, in order to kind of make sure everyone is covered, that's why we're encouraging federal action to make sure that, none of these patients are left behind because of the insurance they have or where they live. And then I think the second part of that question is do you receive these surprise bills based on the facility, based on the service, based on the provider you see? And again, it can be all three, which is why we're asking, not just for protections in a hospital or in an ER, but protections from a surprise bill from out-of-network lab work, or, whether you're seeing, your surgeon's in network, but your anesthesiologist is out of network, or maybe both are. We want to make sure that you're protected there too. Okay, and I think one more here. So this is a good question that kind of gets back to what we were talking about earlier about the tension between how this payment rate is decided. So, I think what we've observed over the past, few months, even before the coronavirus really started impacting people more and more, it was that these committees were working behind the scenes on Capitol Hill, working with, people with their constituents who are from all over the country to come to kind of the best solution here that both protects patients and holds down healthcare costs. So there has been this kind of tension with these industry players, whether it is private equity and healthcare providers and hospitals, and then insurers, and these are all very powerful groups in DC and around the country. And Families USA Action and our Partners No Surprises campaign, our goal is to elevate the consumer in all this. We don't want the family or the patient or the person getting these bills to be forgotten about or left behind. So that's why we had our 3 principles, which I will go back to quickly just so we have it in front of us here, and these are also on our website. But these are the 3 principles that we are working with, and we think that any solution, whether it's arbitration or benchmark or a combination of those, has to follow these in order to truly protect consumers. So that's kind of where we're landing on it. So I really want to thank everybody for joining today, and some really great questions. This recent outbreak has exposed some really big deficiencies in our public health and healthcare systems. We think that Congress has this opportunity now to come together and to slow this pandemic and to improve the system for all of our families. And as they are working to provide relief around the country, and especially hundreds of billions to health industry to support their financial security, to support all of us, we think it's critical that there's also safeguards for the physical and financial health of families that are being treated by eliminating all surprise medical bills. So as policymakers are considering these solutions, both to lower barriers to access healthcare and those to mitigate the economic impact of this recession, we think an end to surprise bills is really integral to ensuring that all families are not faced with further financial burdens and can prioritize seeking care for themselves and their families. So again, thank you everyone for your time. We hope you will join us this week in our Digital Week of Action. We will send around some of these resources after the call, and hope you all stay safe out there. Thank you.